Welcome to the Cash Practice Solution, where we help healthcare providers take control of their practices and deliver exceptional patient care. I'm your host, Dr. J, and today we're starting a new series on balancing patient relationships and practice freedom, because that relationship is everything, but without freedom, you're not going to do it for very long. So in this first discussion, we're going to explore the spectrum of patient relationships and the impact of insurance-based payment versus cash-based practice. Now, understanding where your practice falls on the spectrum is critical for determining the right path forward. Needless to say, we're the cash practice solution. We believe in the cash practice solution. Our team has put together a really cool graphic that kind of gets this whole idea really fleshed out well. And you'll be able to take a look at it. Just click at the bottom of the screen and you'll be able to access that graphic. And you'll get a visual impression of that whole insurance-heavy, cash-free practice, just the freedom that you have with cash and how that transition works. So click on the bottom if you want to take a look at that diagram. So the insurance-based situation is not ideal because of the patient relationship issues. So on one end, you have the revolving door practice where you treat mostly people that you really don't know real well. And to think about it in terms of an urgent care center, that's a really good way to think about it. Emergency medicine, which I practiced for a real long time, you don't see the same person really hardly ever, maybe a couple times a year. And typically that's an annoyance because they keep coming back. But anyway, patients frequently come and go based on their insurance status, if you're insurance-based, creating really low return rates. So eventually you wind up with a lot of strangers coming through. And because of that, there's not a lot of word-of-mouth referral. On the other hand, when you have a strong patient relationship, which is how cash practice usually works, people are not going to spend their cash unless they know you and like you. Patients are loyal. They return regularly. And everybody that they know at parties and church and wherever they're going to have conversations about it. So I was at a wedding just this past weekend, and it was one of the children of a family that I've been taking care of for probably almost 20 years. Probably one of the longest practice patients that we have. And I walked in and I really knew probably 50% of the people because they had referred all of their friends, all of their colleagues. And it felt a little bit like being a rock star because everybody knows me. Dr. J, you saved our life, or whatever and I maybe don't even really know them that well, but in that environment, that referral pool is powerful. There were, 20 or 30 families represented there from this one family that basically referred that group, and it built a hub for referral. So let's look at the insurance world versus the cash practice world. So if you rely heavily on insurance, you're likely dealing with the treatments that are guided by insurance protocols, lots of admin cost, like you're constantly following the codes that they're paying for, following what you're allowed to do, which drugs are approved, and all sorts of red tape. On the other hand, in a cash practice, your bottom line will be better. You're just going to have a whole lot more normal cash flow regularly, and your patients will be healthier because you're doing what, by your experience and training, works, without anybody from an insurance company or a third party telling you, we're not going to cover that anymore. I know that's your antibiotic that you like that works in that situation, but it's not on formulary, so you can't use it. It's a $6 difference maybe, but now you can't use it. It's crazy. So my switch to cash practice started in 1990. I opted out of Medicare because I was kind of proud of the way that we were doing it. We were doing everything online in 1990, which is pretty cool. But man, the administrative stuff was intense. It was a headache. And when it came down to their enforcement, it was just unbelievably draconian. It was such incredibly penalties. I don't know if you know this, but for a federal contractor, in order to be investigated for fraud, it's $200 million before they trigger. For a physician, it's 50 cents. Right? So that's how Medicare works. If you're a doctor, you're under the gun. And not only enforcement, but they've got all sorts of rules for how you bill, how often you can bill, how often which procedure is covered. It's insane. And then, once I'm done with Medicare, I really got excited about integrative medicine. I'm a DO, so I do some manipulative medicine, and naturally, supplements and nutrition and those kinds of treatments come in, and then you have the diagnostic tests that go with it. And insurance companies say experimental, no pay, non-covered service. And that's pretty much every insurer. Very rare that they're covered. And they're necessary if you're going to do that kind of care. If you're going to, and patients want this kind of care. They're asking, hey, can you help me with my nutrition plan? Can you help me with my diet? Well, without nutritional support and help, how are you going to do it? You don't have the diagnostics. You're kind of guessing. So you have to do those tests, but they're not covered. So then patients get upset because you order the test and they're either mad at you, or if you can explain it enough and they're reasonable, they'll be mad at their insurer. But either way, they're mad. It's just not good. And you don't want patients exposed to unexpected, surprise, expenses. They don't like that. Nobody likes that. And it's avoidable in a cash practice because you can tell them up front, you can negotiate a price and create a structure where I'm going to do these plans, I want to do these diagnostic, it's a few $100 here and there. You can tell them in advance. And I often negotiate this with a patient. We can try the treatment without the testing. I'll be guessing. Reasonable. It'll be an educated guess. Or you can spend the $300 on that and maybe not go out to dinner this week. Kind of your call. And then the patient can make that decision. When it comes to insurance, you never know. And typically those costs are much higher. Diagnostic testing and treatments are much higher than we can offer in a cash practice. And so what happens is the patient gets upset with you because you're ordering tests that cost them money, their insurance doesn't cover, and it damages your relationship. And that is, like the wedding, that's the driver of your marketing. That's what really, better than anything. 95% of my patients are word of mouth. That's how it works, and that's because of the relationships we have. Okay, so since every practice is different, should everybody switch to cash? All right, so in primary care, which is really, that's the sweet spot. So pediatrics, obstetrics, and gynecology, family practice, general practice, internal medicine, that kind of entry-level care, so tier 1. If most of your patient relationships are because of the insurance that you're in, which a lot of practices work that way. You open the door, you take some insurance panels, and that you get started. You're in network. If that's all of your practice, you've got some unique challenges. And switching to all cash is going to be a little bit more demanding. And so you should plan on not just a few months, but at least a year to make the switch. But if you're willing to be patient and start to work your practice that way and really learn about it, you can do it. And I really recommend, we've done a bunch of podcasts in the past, to look at the beginning podcasts and work your way through, because we talk about how it works, how you can do it, and it's a good foundation. And one of those points is that if you're in that kind of practice, your patients come to your practice expecting their insurance to work. They come to that building. In that planning, to a year or two, you might want to change your physical location. Just get a new space if you're renting, and then you'll have the new space is all cash, and that's how it works. Your freedom to practice according to your best judgment and your conscience, 30 to 40% overhead. Those things, you get to do what you want. You get to do what you know works. You cut your overhead almost in half by getting rid of third party. Be creative. Think about the ways that you could make the switch. Start talking to your patients who are under insurance and say, hey, I'm making the switch, or I'm thinking about making the switch. Now, on the other hand, you may be the kind of person who's just incredibly warm and great personality, and everybody that you talk to, whether they're insurance or somebody, at the PTA or whatever, you just hook up and make great relationships really, really easily. So the insurance thing is a whole lot less of a deal. So maybe you can make a really quick switch. You don't have to be limited by that just because you take insurance. You just may. I know doctors like this who are just incredibly warm, and their patients all love them. And even though they take insurance, the quality of care they give and their relationships are really solid. If you have that kind of personality, over 50% of your patients are going to stay with you. Some as high as 80% will stay. And some of that has to do with your pricing. Previous podcasts will teach you about that. You can learn about that. As you switch to cash, you're going to see that your clinical decision-making becomes really, really clear. You don't have to check with the insurance. You don't have to check which codes cover. You just make the decision. You make sure that your pricing is reasonable. So instead of investing your energy in just idiotic documentation compliance, which is one of the reasons that I just absolutely couldn't tolerate it. You can take back 30 to 40% of your overhead and 2 or 3 hours a day just by doing that. That's without really great technology and all the other things that are available where you can save another couple of hours a day. So you can double your output and certainly increase your profitability. And then you're the kind of doctor who patients will spend their money, and you're worthy of it. They're worthy of every penny that they're giving you, and you're giving them something it's more valuable than anything else they can get. The relationship, the knowledge, the whole system that really works. So the sweet spot is a really strong patient relationship and not taking insurance. That allows you to achieve optimal revenue, and you can work pretty much as much or as little as you like. You can work 5 days a week if you like, if that works for you and you have the energy for it and you want to see patients for 7 or 8 hours a day. With good technology, that's the whole thing, 7 or 8 hours. You don't have, the documentation is cut down so much that you don't have additional documentation time that you've got to make. Within an appointment, a minute or 2 minutes is plenty to do all of your documentation with proper technology. You can have very low patient turnover and have amazing outcomes. And we have a saying, and we've worked with this for years: the freedom to choose is the power to heal. And if you have the freedom to choose in a cash practice, which you will, you'll see your patients do much, much better. The frustration level, the peace that they have because you're doing the right thing, it's impressive. I know that it's a thought that you've probably had, is that how much impact do you really have? Do you really matter personally? You, as the practitioner, clinician, practitioner, provider, nurse practitioner, whatever, you are the medicine. When you walk in that room confidently and you give them everything that you've got, you change them before you make any treatment available, before you prescribe an antibiotic, before you do hands-on treatment, before you do anything. You've made a change. Look at where your practice fits in this pattern. Where are you? Lots of cash, little bit of cash, heavy insurance. Look at the spectrum and consider what's driving you. If you have questions about it, send them to us. We're going to recap this series as we go through, and we're going to answer as many of those questions as possible. And if you haven't already done it, there's at the cashpracticesolution.com, there's a scorecard, and you can fill that out. It goes through a lot of really good detail so that we can give you a really good assessment of what kind of steps you need to take to have an incredible, incredible transition to cash practice. And if you listen to your patients, yes, listen, learn their story, and you just love them wholeheartedly, you will be unstoppable and you will succeed. So thanks for listening, and we'll see you next time.
Thanks for joining us. And if you have enjoyed today's conversation, be sure to hit subscribe so you don't miss out on future episodes packed with insights to help your cash-based practice thrive. And don't forget to check out all the tools and resources available at cashpracticesolution.com. They're free to you, and we're always adding more. Keep raising the bar in patient care. We'll reconnect in the next episode with more ways to help you succeed.